Swati Keshavar. Today we'll be talking about orofacial reconstruction of lower one third and middle one third of the orofacial maxillary region. I present to you Mr. Suvayan, Master Suvayan, our dearest Suvayan, along with his mother. Good morning, ma'am. So this patient initially had presented with a very forwardly placed maxilla, that is it was Angus class 2 division 1, and the patient also presented with retrognaathic mandible. Also, as we can appreciate that the patient had a deviated nose with the base being directed towards the right and with the apex being directed towards the left. So initially the patients, so we talk first to Ms. dearest Suhail, and then we'll discuss about what has been done. So what was the actual problem you had come with?
I had lower one third and middle one third deformity. My jaws were a little backward. My nose was tilted right side, and my teeth were also raised. Like you can see that in the computer. It made me look very odd.
Okay, so had you undergone any previous treatment for this?
Yes, in Malda, the dentist suggested me braces, but I didn't have any improvement of teeth.
So you were not at all satisfied
no.
with the treatment. So then you came to Dr. Anirvan Sengupta. Okay, so Dr. Anirvan Sengupta had then finally treated him. The procedure done was segmental osteotomy, along with chin augmentation was done, and also, as we can appreciate, also the deformity of the nose in which the base was directed towards the right and the apex directed towards the left was corrected. Initially, as we can see in the cast, the patient had an excessive class 2 division 1 malocclusion, and with the lower teeth touching the parietal area. So the patient also had a high chances of developing ulcers in this area. So in the post-operative, Dr. Anirvan Sengupta, as we can see, has corrected this by segmental osteotomy. Now we'll ask the patient how satisfied he is with the procedure. So how are you? Like, how do you feel now?
I feel very nice now because all my problems have been solved by Dr. Anirvan Sengupta. Now I don't have the deformity which I used to have. I had the zygoma deformity also, but those are also corrected. My jaws are now, my lips meet each other because of the correction of skin problem.
So your eating problems, everything must have gone
Yes.
now. And you feel good about it? You feel confident about it?
Yes, I am confident about it.
Are you satisfied, ma'am?
Yes, satisfied.
Okay.
So we have gone through the interview had taken Dr. Sati Jaiswal, MDS, on the dearest Suvayan Das, who was looking like this. This was the previous Suvayan, and this was the previous deformity of the lower one third and middle one third of the face, along with the deformities of the nose. And we have seen the positive replica of the nose here. And if we draw a straight line, it will go to the here to 90 degree, but it is base is totally right side tilted and apex is left side tilted. So nice interview, we have enjoyed. Now we'll ask Suvayan, what about your mental or psychological status? What's the difference between previous Suvayan and now Suvayan?
Previously I wasn't confident about my face. I felt shy to go outside to talk with my friends because of the chin problem. But now I am confident because all my problems have been solved. I am looking better than before.
Okay, Suvayan, many happy returns of the day, and congratulations for your new life, like your new face, right? So we will see. This was Suvayan some days before, just 15 days before, and now after 2 or 3 days of the reconstruction, we are getting Suvayan like this. We'll ask Suvayan one thing more. What was your gagging reflex? Anything is put in your mouth? What was happening here?
Yes, whenever someone put fingers inside my mouth, I felt gagging. I felt vomiting because of that. But now because of treatment done by Dr. Anirvan Sengupta, that problem is now gone.
Dr. Sati, can you have any explanation of this? What was the muscles related of this, or what was the done? Why he was having the gagging, and now now why he is not having any gagging reflex?
Basically, initially, because of the maxillary prognathism and the recognitism of the mandible, there was pulling of the muscles, like as we know, the digastric muscles. Now, during the procedure which was done, this the digastric muscles were also relieved. It was relaxed, and hence the Suvayan did not had any further gagging reflex problem.
Right. Currently, Dr. Sati is saying that, and so we have seen is blood ascites region and neck region is totally okay. No other feelings like previously. Okay. Thank you everybody for your and mainly Suvayan for your good and prosperous life.